So I think we'll just go from left to right. So we can start with Rafael, and then you can just quickly introduce yourself, quickly introduce your association, and then try and focus a bit on what the WVA, so your association, does in regards to One Health and One Welfare.
Okay, well, as you all hear me this morning, I'm Rafael Agues, President of the World Veterinary Association, and for us, One Health is a very important topic. Even we have, as I mentioned this morning also, we have a working group of specifically in One Health. And also we have several papers regarding One Health, education on One Health. That means that, yes, for us it's very important. And as you say, sometimes we define, and probably in this moment we have in the situation that we need to continue talking about One Health, but it's the moment to put in practice One Health. It's just to go to the ground and any of us work with under the One Health perspective. And other important thing is to include, pay more attention as professional in the environment. We are focused, and we need to be focused in clinical skills and so on, but I think that we need to see around and see in which environment we are, our animals. My opinion, I put an issue on the table is pay more attention in the environment. Not be a specialist in environment, but pay more attention. It's okay?
Perfect.
Okay. Well, my name is Mary Marcondes. Everyone knows already. What WASAVA does? WASAVA has two committees. One committee that's the One Health Committee, and then we have another one that's the Wellness and Welfare Committee. And apart from including a lot of resources in our website, and we have this One Health course that is certificated. You can, as I told in the morning, you can join this course, you can do it. It's inside the Colorado State University website, but you have the link through the WASAVA website because the chairman, Professor Michael Lepping, is from Colorado State University. And one thing that we try to do is we have those press releases every month. And during the pandemic especially, Michael started, I joined him for a while and then he started alone, but he kept doing this alone. We have press releases, or we had and we still have press releases about One Health, especially SARS-CoV-2, during the pandemic, like every 2 weeks, about what was going on, the importance of what we needed to do, and pets related to SARS-CoV-2. So, yeah, we try to keep sending information about One Health important topics during at least twice a month, and this is something that we try to do all the time. And absolutely, I agree with what Rafael said. Yeah, try to focus from now on, because I think this is a problem. We will probably mention this afterwards, but this is a problem, at least in Latin American countries, that we have a lot of One Health issues here, but we are not prepared to deal with this. Not we, I think vets, yeah, we don't have the skills. During our graduation, we don't learn enough to know the importance of One Health. So you have practitioners that really don't know how to go into the subject, what to do with this, and this is something that, of course, our organizations try to do, SIVA tries to do. We have a lot of people trying to do this, but we have to focus on our undergraduate students here.
All right, thank you.
So good, thank you for the invitation again. My name is Janaína. I am in the lead of innovation and development for SIVA in Latin America, here representing the company. And regarding One Health, I think I mentioned a lot during this morning some of the initiatives that SIVA as a company is putting in place to try to focus on One Health and also on One Welfare. I agree it's getting harder after so good explanations, but I agree with all of both of you said, and I think from a company perspective, there is a lot that can be done to try to give more information for the customers on how to deal with zoonoses, and also to bring new technologies, focus on One Health, to consider also all the vet expertise that we have in all the species, the access to new technologies and to new products, new vaccines that can contribute to really controlling some disease and putting more information on the market regarding some pathologies.
Thank you. Anya?
So hi everyone, I'm Anya, I'm the president, and today I'll be speaking at this panel on behalf of veterinary students. And this is because I believe that students should not only be passive listeners, we need to be part of the discussion, we need to be part of the solution. And of course today it's me speaking on your behalf, but I hope that at the earliest possible convenience starting today, it will be you speaking up, sharing your perspective, and taking the initiative on, of course, One Health and One Welfare and other important discussions. I believe I don't need to introduce IVSA much, since we have seen several inspiring presentations on our activities regarding One Health, regarding animal welfare, of our standing committees, of our organizations, advocacy during partner events, but even just simple discussions like here now among yourselves, this is already something that helps us to create a platform to learn from each other, to exchange this experience, exchange those ideas, and this is how together we really improve the veterinary education and veterinary medicine. So thank you to all of you for that.
Thank you. So good afternoon everybody. So I'm Pierre Lequeux. I was Dean of the Vet School of Liège in Belgium, and I know the director of IVSA, which main mission is to accredit veterinary faculties, mainly in Europe, but also elsewhere in the world. You know, the faculty of Sao Paulo has formally asked to be accredited by IVSA. So for that, we have developed what we call standard for accreditation. Is 55 standards, and each veterinary school must be compliant with all these standards. And of course, students' affairs are extremely important in these standards. Many standards are devoted to students, including students' welfare, and many standards request an important involvement of students in the decision-making process and in the evaluation of the implementation of the decision. The second important task is the definition of what we call the day one competencies. And it's what need to be known by all graduate students the first day of graduation. And you know, this is a big problem. Sometimes some teachers teach too much, which already specialization, and some teachers do not teach enough about things which need to be known by any veterinarian going to the field. And of course, One Health and animal welfare are extremely important in this standard and in day one acquisition. As you know, it's first a way of thinking, and secondly is the knowledge of the right procedure to do it. And I agree with Raphael that it's enough blah blah and enough speed about it. And you can speak about importance of One Health, etc., etc. So no, you need to know what you should do when you will arrive in the field. And we will initiate the discussion, but for me, it's two essential things in addition to the knowledge of procedure. First, in the acquisition of soft skill, communication. Some graduate students are really good, some others are unable to communicate. And without communication, you are dead in the field. And we are in a changing world, in a world changing extremely quickly, and it's important to communicate well. And the second essential thing today, it's a quick access to relevant database and relevant algorithm. Without database, nobody knows everything. This was the past, when one person was supposed to know everything. Things are changing so quickly that you must immediately have access to excellent database, and not only Google. And you must also be able to use the algorithms in order to help you to make the right decision. And there are more and more algorithms able to help you just by using a mobile, for instance. But we will discuss on these different items.
All right. Thank you very much. All right, so our panel discussion is going to consist out of 2 parts. The first part is One Health and One Welfare in Veterinary Education, and then the second part is animal welfare and its impact on public health. So both of those parts are going to exist of me and my fellow moderator, Ahmed, asking some of the questions. I'm going to come sit down there. Asking questions to some of the panelists. Once we've finished our questions, we're going to open the floor. You guys get to answer. You guys get to ask some questions as well. You can either have a specific question pointed at one of the speakers or 2 or 3 of the speakers directly, or it could just be towards the panel and then we can see who wants to answer. It'd be great if you guys would interact, obviously. That's what they're here for. And then after each part, we're going to get a 5-minute summary from our lovely Matthias. Okay, then I'm going to now get down so I can actually look at the panelists when we ask the questions, because that is a little easier.
So let us start with the first part and with the first question. How can veterinary institutions implement education on public health and animal welfare policy and make these courses more interesting for vet students? Let me give the floor to Bea.
I don't.
Repeat the question, okay. How can veterinary institutions implement education on public health and animal welfare policy and make these courses more interesting for vet students?
Okay, so I believe that the first thing is for most, if not all, vet schools to be accredited and to be obliged to be compliant with all standards and to ensure that graduate students will have acquired the day 1 competencies as discussed previously. And to do that, it's important to have the different steps in education. As you know, it's theoretical training. Then you have practical training on monkeys. We call it skill labs. Then you have training on healthy animals. And finally, you have training with patients. And I believe this is very important for having ensured one health and animal welfare. Secondly, I believe that veterinary institutions must contribute to develop new tools to improve animal health. For instance, just an example, in the Netherlands, many slaughterhouses have been equipped with cameras linked to a specific algorithm, which may analyze cases of non-welfare in animals before to be put down. This is an example of a tool which really contribute to improve animal welfare.
Okay, I'm giving the floor to you, Aga.
Okay, thank you very much for the question, Ahmed. It's a very good question, and I believe it's also a question that everybody keeps asking nowadays. How to implement the One Health in veterinary education, in veterinary curriculum, and there are several different ways to implement more courses, to increase the education about it in already existing classes. But I feel like it's all theory. We really miss the knowledge about practical implications of, for example, collaboration, the One Health approach, or practical implications of animal welfare on the public health. And I think helping us to gain a better understanding of the implication of the practical knowledge This is something that will make the courses more interesting for veterinary students, and also ask for involvement, ask of making us more engaged in the courses. It's, I think, enough to just look around here. We are not part of IVSA because we get grades for it or some special credits. All of us are here because we actually want to be involved, because it's very important for us to come up with the initiatives, because we have many ideas, and just giving us a room for talking and taking a lead on the initiatives that are dear to our hearts, like for sure animal welfare and One Health are very important to all of us, would also, I think, increase the engagement of veterinary students.
Thank you, Bilal, and thank you, Anya. I also want to hear from Mary.
Okay. Well, as I told you in the beginning, what I realized, and I'm talking about Latin American countries, we feel that we have this lack. We don't learn this in our university, and I can tell this because I was, until 4 years ago, I was the vice dean of a veterinary school at São Paulo State University here in São Paulo. Is another public school that we have in the state. So I was facing this all the time. You know, we don't have this because we cannot, at least in Brazil, you cannot change the skills that you are going to teach unless you have an approval, a federal approval about what you are going to teach. And this happens in many other countries in Latin America. And the problem is that people don't learn what's the importance. So I think we should start working with like governmental persons that could really help us, you know, and this is probably our job as an association or as associations to try to reach these people and teach them the importance and tell them the importance of teaching this since the beginning. I will just give you an example. I was looking now on the internet. Michael did one really nice project, and he also published this study. One health approach to prevent obesity in people and their pets. We don't think of this kind of situation, you know, like we talk a little, we talk about environment, about infectious disease, but there are so many other things that we need to pay attention, and this is related to One Health. So I would say that the problem is in the base, and that we should talk to people that could help us change the curriculum of vet schools, especially in countries where I think we need most, like countries like Latin American countries, maybe Asian countries, where we have a lot of problems and we are not teaching our students properly. That's what I think.
Thank you, Mary.
Something?
Yes, of course.
I want to be positive in this question. And just with an example, there is a veterinarian, a German veterinarian, I don't know if the German colleagues are in the room. It's called Lothar Heinz Weiler. He is a veterinarian from Germany. He studied in the Berlin Veterinary School. And when the pandemic, started the pandemic, and he had been working all the time in epidemiology and antimicrobial resistance, a lot of research. And then when the pandemic arrived, he was president of the Koch Institute, that is the most important institute about public health in Germany, a country that is something, we know when we call about Germany what we understand. And he was there, and he was taking care of the pandemic, one of the two, together with the hospital, what is the charity hospital. He was a veterinarian, but they don't choose because he was a veterinarian, because he, with the education received in a veterinary school, could reach the Koch Veterinary School. That means we have started to talk about One Health since the beginning of this century, but we have been doing One Health since we are veterinarians. Saying that, I don't tell that we don't need to improve our education in this topic, but we need to be conscious what we are doing already. before talking about that in this. And just, I want to read two definitions. I need to go to read. One is, Pierre Lequet mentioned about the one-day competencies. Normally in Europe are not the same like in North America, but we have a body that is the OIE, that in the OIE recommendations for as first one-day competence says they want graduates, all the veterinarians, regardless of their professional area of practice, after graduation, are responsible for promoting animal health, animal welfare, veterinary public health, and food safety. That means our knowledge already give us the opportunity to do that. We need to be conscious. Is when I say, be conscious. Think a little bit what is One Health. Think a little bit what you are doing, what you know, and just put together. You are going to find solutions. You are going to find replies. And the reply is going to be different for any of us. And let me tell, you mentioned public health. There is a definition about veterinary public health that is stated by WHO several years ago. I think that was in the last century. Is veterinary public health is the sum of all contributions to the physical, mental, and social well-being of humans through an understanding and application of veterinary science. This is public health. Veterinary public health. That means, again, think any of us, what we do, simply we need to have our eyes open and analyze what we are doing and what consequences have in the health of our practice. Even if you are a practitioner, I don't know, companion animal practitioners that are super specialized, you have an impact in public health for sure. And even if you are in an office, being official vet, for sure. Just analyze. That's my positive approach. But of course, I am exigent, we need to improve that. But we come from this base. The professionals that understand better One Health are our profession. We need to help the rest and do the work together. But I am positive.
All right, thank you so much. All right, then for the second question, after this question, we're going to also open the floor up to the people to ask questions, and then we'll see. We have some other ones, if we can use our own, or they have other things they want to know. For the second question, how can veterinary students keep up to date with current animal welfare guidelines and legislation and incorporate these updates into their training? And then I would like to give the floor to Janaina first. I'm sorry if I did not
No, it's a hard name for everybody out of Brazil to pronounce. No problem. So it's hard because there's a lot of things coming up all the time on new regulations and new guidelines. But for sure, those associations here would be always good tools and good ways to keep updated. And for us inside the industry, we have very clear guidelines from authorities from each country to follow especially regarding animal welfare when we deal directly with animals. So we need to be working very close to the authorities, first to keep compliant to those guidelines, of course. Look for the better standards because it's not always the best ones, the ones that we have on our countries. But for example, Europe and US always have guidelines that we also follow because we know that they have higher bear of levels of requirements. So we try to follow the best that we can. So that's also something that we need to do when we look for the industry. But considering the veterinary students, I think that the best way would be always to keep updated on good congress, good quality level of associations that compile those guidelines as mentioned here. So I think that would be the best way always.
All right, thank you. And then Mary, if you want to answer?
You know, I would just include CDC, WHO, a lot of other resources that we have. We are lucky, you are lucky, you are in a generation that you can find anything you want on the internet. We were not, well, I can talk about this, yeah, because when I started, or when I was a practitioner, when I started to teach at the university, we didn't have internet. I have to tell you that I'm old, so it was impossible to have so many resources as you have today. So I would definitely try to go to this websites. Just one thing, I absolutely agree with what Rafael was saying, that our profession is the best profession when we think on One Health. But just to, it's important, just to give you an example, I was thinking after he said this. Sometimes you have a practitioner in a clinic, a small animal practitioner. He looks at a cat with, I don't know, cryptococcosis or something like this, or anything that he knows that this is a public health, or it's important regarding public health, and he keeps this information inside his clinic. And this is the thing, I think, that he was mentioning, like, open your eyes, because the first thing that you have to do when you are like on an endemic area of Easter leishmaniasis or anything like this, is go to authorities, talk to authorities, talk to to human practitioners, and try to have this connection. Yeah, that's something that we usually don't have. And I was reading an article another day that they were asking practitioners, human practitioners, how many times they interact with vets when they find out that they are dealing with a zoonosis. And the response, the answer was like less than 20%. And then you go to the vets, how many times a vet talks to a practitioner when he is looking at a dog or a pet with zoonosis? And it's around 60%. So we try to do this more than human practitioners, but we need to keep doing this all the time, just as an example. Okay.
All right, thank you. And then Rafael? Yes. He was already reading.
Got me if I talk too much. You know what to do. You know what to do. Now, the question is, really, even practitioners, even veterinarians that are in practice, have this problem. You know, because in some countries, I come from Europe, and European legislation know that it's quite complex, quite exigent, it's changing all the time. It's almost impossible to be on the that's, and of course there are tools, all the legislation is online, but I think you as a student, so far, you don't need to have all the information in the moment. Because the animals that are in the school, the responsibility to accomplish with the animal welfare legislation are the school. It's the school that need to know how to deal with these animals regarding, and other thing, correct me, Pierre, I am going to ask your help. I think in the program, at last in the European schools, there is something regarding with legislation and ethics. You need to be educated on that, and then when you go out the schools, you need to follow and see that this is very important, not only the science, but the ethics, and accomplish with the law. You need to go, go with Mary, you need to go to what is the legislation that you need to know in your country, and to see, and of course, talk with your colleagues, but it's a very difficult issue. Legislation in general, and animal welfare legislation. That's my approach.
All right, thank you. Pierre, would you like to add something as well?
Just maybe, of course, basic training must be provided in vet school, but although you are all extremely smart people, it's impossible to know everything. So, as told you previously, access to relevant database is really a key point. First problem is to develop the right database. Secondly is to update it. You know it at the website or a Facebook page which is not regularly updated will die extremely quickly. And third thing, also extremely important, is to inform all relevant persons about the changes and the addition, so you are not obliged to read it again. And of course, as suggested before, it's absolutely necessary to participate to international meeting and scientific meeting just to refresh you and to remember you that you must update your knowledge.
Yeah, of course.
If I could add a student perspective to this, I believe the lack of information sources, as we all highlighted, is not something we struggle with. What we struggle is infodemic, so too many information sources and us having difficulties to prioritize which are the relevant ones, which are the important ones for us to follow. And there comes like the importance of guidance and mentorship for veterinary students that I would like to again highlight here.
Yes, very well said. All right. Does any one of you have any questions for our panelists regarding One Health and or animal welfare when it comes to veterinary education? Okay. Okay.
Want me to come there? Susanna Salvadori, IVSA. I wanted to ask the associations that are here today, International Association, if you are already working together with other medical associations, for example, Human Medicine Association, because in our way that we can, as small associations, for example in Italy, we are doing a partnership with the, let's say, the human IVSA. So I was wondering if this is something that globally is already done. Thank you.
Yes, I mentioned this morning in my presentation that we have already done 2 conferences, one in 2015 with the World Medical Association, with the Veterinary Medical Association, and the 2 national veterinary and medical associations in Spain and in Japan. We have a memorandum of understanding between the 2 organizations, and we are invited each other to our general assemblies. I have been attending, and I put this morning on the screen, of the General Council that was in May, I think that was April in Paris. That was one of the pictures that I showed this morning that we have been talking about. I have been invited to write an article about One Health in the journal of the World Veterinary, the World Medical Association. That means that yes, we are working at global level, but to put in place we need to work at national and local level. But yes, we are working and we are trying to understand each other more and more. I don't know if that replies your question.
Yeah.
Yeah, we on our One Health committee, we have human practitioners, we have people from CDC. This is the only committee where we don't have just vets. We have human practitioners and we have people from CDC also to help us in this subject, you know, One Health. So that's what we do. We don't have this kind of partnership that he mentioned, Rafael mentioned, but we have like people inside our committees that can help and can make us have this connection with other governmental human like CDC and like WHO. We have people from them in our committees. That's what we do.
So IVSA, of course, also collaborates with other veterinary student associations under WHSA, which is World Health Student Alliance. We work with IVSA, so medical doctors, IPSF for pharmaceutical students, and IVS for dentistry student, and also with agriculture student. So there are a lot of ongoing initiatives, especially with our standing committee on One Health. So this is what IVSA is doing, but as for students' activities, maybe what we should look into is more activities on the university level with other health professional students. because like, how can we be expected to follow the One Health approach and collaborate with other professionals after graduation if we don't do it just yet as students? And so definitely this is something we should look into.
Just a brief comment. It's, of course, all organizations will tell you that we are fully concerned and blah, blah, and blah, blah. When you go to the field, when you meet veterinary practitioners, they are already very concerned about One Health, One Welfare, etc. This is not the case for human physicists. And most of the time, they just blame veterinarians and animal owners because humans are sometimes infected by animals. So it's a lot of work to do in the education of human physicists. Second thing, just for your information, there are some groups which really work on it. For instance, there is a cost action in Europe, which is funded by the European Union, and working on the development of a database on biosecurity and welfare, especially in food-producing animals. So these are trying to develop a database, to put in place a procedure to update it, and to inform the practitioners about all the changes.
All right. Any other question?
Constantine Luca, IVSA Greece. I have a question for you, Mr. Pierre. So you talked about... Yes, is it better? Yes. So you talked about accreditation systems, different vet schools, right? So I guess I understand the day one skills, that it's a practical, let's say, thing that we can control. How can we add the One Health in the universities, and in what way could we check this box to make sure that every, let's say, accredited school or every school has enough education on One Health?
Yeah.
If it makes sense.
Yeah, so first of all, it's difficult to assess the acquisition of a concept. Same, it's very difficult to assess the acquisition of soft skills and communication skills. So my personal view is that if you want to be efficient, you need to have several ways of assessment. Written assessment, multiple choice question, oral things, OSCE, and practical in clinical situation. What I believe is extremely important in the future is further development of skill labs. It's becoming very popular in many schools, and it's not always a question of big money. Of course, the big markings of horses and cattle are quite expensive, but most of the time it's very cheap. It's just done by one clever technician, which is able to develop it. And there are many, many examples in the world about that. The second thing is what we call the mock clinic. So it's a playroom. And it works very well in many schools. I was impressed, as you know, I visit many schools every year. And some organize a mock clinic. And so the student sometimes is the owner, sometimes is the vet, sometimes is the dog, or the nurse. So then you can realize all different aspects of relationship, soft skill, welfare, etc. And of course, this must be included in the One Health concept, which include humans also, but as previously, environment. And this is something new since a few years. One Health is health, welfare, and sustainability of animals, humans, and the environment where they live.
More question?
So, and I'm from Germany. I don't know, it's not really a question, it's more of a statement. Talking of one welfare, we should, I mean, it is also part of One Health, we should definitely take into consideration the emotional and mental state in veterinarians. I mean, we are all aware, I think this is kind of a global thing, that there are many mental health issues in veterinarians, but it is more to it than, let's say, the classical young, dedicated woman going into depression or even suicide. There's way more to it when we're talking about animal welfare, and I mean that is the One Welfare approach exactly addresses this as well, that we as humans need healthy animals and a healthy environment to also feel healthy and have a certain state of welfare, let's say. But we also need mentally strong veterinarians, mentally strong humans to be able to achieve animal welfare. So those topics are deeply connected. I just wanted to state that we should maybe, talking about veterinary education, we should also address the subject. Maybe we don't have to discuss this here. Have a mental state that is able to address certain topics, because animal welfare is a very controversial topic, and students and future veterinarians need a certain, let's say, we were already talking about soft skills, but they also need a certain how to say, mental state to be able to communicate this to themselves, to other veterinarians, but also to animals, to everyone. So, yeah.
Just a comment, I fully agree with your analysis, and I'm terribly afraid by the fact that quite everywhere in the world, around 25% of young vets stop completely to work in the profession within a short period of 2 to 5 years. This is terrible. It's a huge loss of time. It's a loss of money for the parents and for the society. And it's a terrible demotivation for the person. So I believe that it's extremely important to focus on this. As you know, for Eve, we have a strong standard ensuring the welfare of not only the animal, but students and staff. Because to be a good vet, you need to be strong. To be a good teacher, you need to be also strong, in good condition. And I believe this is very, very important in the future. And the fact to add different way of training, intramural, extramural, mock clinic, real clinic, dispensary, help a lot to really improve your mental and to be able to face the reality. And I fully agree with you. You can only be a good vet and take care of health and welfare of animals if you are yourself strong.
Yeah, I agree with you also. And if you look at some index, we know that vets are on the highest top of suicide among medical profession. Yeah? And this is something that's really, we have on Wasaba we have a committee just in charge of this, and we are conducting a research here in Brazil, and what we realize about those results that we are getting, and not just because, not in this questionnaire now, not in this research now, but I'm talking about everything that this committee does, is that this is really scary. And if you look at the situation of vets nowadays, I'm talking about small animal vets because that's what we do, but this is something that we really need to look at. You are absolutely correct, and I think this is a nice topic for next Congress because this is really important.
I agree. In fact, the last year in our World Association, in the World Veterinary Day, the theme was a resilient profession. That means the issue is detected, and we need to work on that. And I repeat again the definition that I mentioned about health. Health is mentally and physically. We need to take care both. And simply we need to again, to repeat and repeat, and to realize that are together. That we cannot divide our mind from our body. the health is together, from humans and from animals. That's why we are talking One Health and health is together. But in humans, it's the same. Sometimes we used to forget ourselves because we are devoted to our goal, to our profession. But this is something our society needs to take care in and ourselves. And we need to help each other in the associations, among the profession, in the schools and so on. But totally agree. Health is mentally and physically, for humans and for animals.
Alright. Any other question?
Yeah.
I just wanted to say it is not impossible. I didn't want to pull you down or anything. I just wanted to address it. It is definitely not impossible. And yeah, we can deal with it because the veterinary profession is amazing. It is the great job, the greatest job possible. So we can do that, and it is not impossible. Take care of yourself.
Go ahead, Ellison, with your question.
Ellison Brown, IVSA, Trinidad and Tobago. So I actually wanted to ask more on the environmental side of it because, forgive my pronunciation when I say this, but when we went on the zoo tour to the Guarulhos Zoo, they had mentioned that one of the marmosets had become endangered partly because of the city expanded their habitats has shrunk, but then when other species have been released, they had released them into the wrong area, and because that species was more aggressive, the smaller species started to diminish. So I wanted to know if from, an association side, is it something that you can lobby against to maybe have a group of veterinarians survey the habitats before expansion takes place? Because obviously a city will want to expand as quickly as possible, but you will still need time to survey it. How do you balance the needs of people in this case in terms of expansion and generating income along with maintaining these habitats for these animals and things within this aspect, more or less?
But in fact, I think we are behind that. What I say, sometimes I heard some discussion. In fact, in our mission at this moment, WVA is not the environment. Because internally have been some discussion. Some veterinarians think that if we are putting attention on environment, and when I mention environment, I mention natural environment and human environment. We are in Sao Paulo with a specific environment of the huge town. This is environment also. I mean, my concept of environment is all this. But when in some working group, when we mentioned that, some member of the working group said, no, don't use the word environment. No, because the environmentalists are going to come here and and I suppose there is also the discussion about the industrial production, and there is the discussion around. There is many, and the impact in the environment. That internally we have some discussion also, defending the industrial production and so on. I understand that it's a difficult topic, but it's something, even if it's difficult or it's controversial, we need to be part of this discussion. Even if we want to defend the farm industry, we need to have good. But I agree, I need to confess, our organization, WDA, is behind that in this topic. What I try to do is start to this discussion. But the reality is this, according to me.
Yeah, the same regarding WSAVA, we have a few discussions when we talk about One Health, but this is nothing that we are really actually working on. Yeah, I have to confess the same.
From an industry point of view, I think there are different ways to see that, because we have our own commitment to what we are doing inside the industry. So we are looking into it, especially in SIVA. I can say that there is a big group working on it, looking for the impact on the environmental of each of our manufacturing sites. And from the other side, we are also trying to look for devices and technologies, as he mentioned, to try to support the farmers to measure methane, carbon, what they are really producing, how they can control that, how we can look for products to support farmers. So as we have close contact to the customers, we are also looking for that to see how we can support it in the future. But it's all very new, everything is happening too fast, and it's even difficult to be up to date and to see what we should focus on. It's too much things happening all together. So I can say that from SIVA we are looking for how we can support, if we can look for products, and to do our job internally also.
From students' point of view, I think what's important is to talk about it. So first of all, thank you for that question. And talk about it to build an understanding how we can apply the theoretical knowledge and why it is important to tackle animal welfare for human health, for animal health, for environmental health, and what are the interlinks among the all three. And if we will understand the reasoning, I believe we'll start to pay more attention and take small steps towards the improvement.
Yeah, so to be practical, vets are not responsible for the major problems on Earth today. However, we can do, from my point of view, at least two things. The first one, when you have two options for treatment, prevention, etc., you need to think about the one which is the more gentle for sustainable environment. And that's one thing you must also always think about. Sometimes you can do nothing. Sometimes you can a little bit contribute to improve slightly the environment. Second, you have an important role in communicating to the appropriate person the truth. And for instance, as you know, sometimes people blame animal production about contributing to the warming. It's true, and it's not true. Probably it's true for highly industrial animal production. And personally, but this is a pure personal opinion, I believe this highly industrial production in animals will be in trouble in the future because consumers do not want it anymore. On the opposite, it's totally wrong to blame ruminants to produce gases if they are in the feed. Because in life, everything is always a question of balance. The problem is not the production of CO2. The problem is the balance between production and captation. And ruminants which are in the feed, of course, produce CO2, but the feed is extremely efficient to capture CO2, like forests in Amazonia, for instance, or in Africa, or in Siberia, or like Posidonia in the sea, which also are in trouble. So I believe that we need to try to open eyes and to avoid stupid criticism from people who really don't know what the real things. Always things about balance. That's, I believe, the most important things.
I agree with you about how much wrong information is around this topic, and I think that something that the vets are not accountable for but can contribute is bringing information to the farmers. Because what the first work we did in SIVA was to have a survey with the farmers to see how much they understand about it, about the impact, about how to balance. And what we realized is that most of them, the small farmers especially, they don't even know about it. They don't even know about how they measure, how they contribute, how they react to this kind of information. So I think that we are in close contact with those farmers, we as vets, so we can bring information and we can support them with those kind of information to contribute.
Alright, so I'm going with my third question and I then will open the floor again. how can veterinary institutions and vet students open channels of collaboration between members of different health disciplines and policy-making bodies? Giving the floor to Rafael.
Apart from the activities I mentioned before, I remember something that is in Europe. I remember some letters and some seminars that we did together. The veterinary profession, European Veterinary Professional Association, Federation of Veterinarians of Europe, and also the Federation of Physicians of Europe, the dentists, and we sent some letters to the different health schools in Europe to remember. Do you remember that, Pierre? Asking them to work together in this One Health project. And seeing Daniel here, that is from Copenhagen. In Copenhagen could be a school, could be a good example. Probably you can tell us something about that, about how is your university working together in the same campus with physicians, dentists, and veterinarians. In some universities, they have this approach, and I don't know, I should like to hear you as a student of an institution like that. If that works, that is positive, I should like to hear your opinion. But these are the examples that come to my mind in this moment. And this is not only in Copenhagen, in other places also, but this is another possibility.
Well, no, the only thing that I was going to say is that this brings to my mind the same thing that I said in the beginning, like that during graduation we should try to do this kind of interaction. For instance, I graduated 35 years ago, more I think, here in this school, and we have in the same campus vet school, medical school, dentistry, and at least as far as I know, we don't have this interaction between those different schools here in São Paulo. And in Unesp, where I used to teach, it happened in the same way. So this is something that I think we should try to do. And I would like to hear this, what happens, you said, in which country was it?
Denmark.
Oh, please, tell us about.
So Daniel, and I'm from Denmark. In Copenhagen, our faculty wherein veterinary medicine resides is under the health science faculty, and that's odontology, humans, pharmaceuticals, public health, and veterinary medicine. So we are around 13 bachelors and 6 masters, I believe, and then we have some other specific masters as well. But yeah, we do have a 5 European credit course that is held alongside human medical students that we have as one of the last parts of our education, and this is called a One Health course. The idea behind it is very, very good. The current way it's handled is not 100% ideal, because what usually happens is we get there, and then because the medical students are so many more than we are, it's 1 or 2 vets and then 10 medical students, and it usually just turns into the medical students deciding that whatever we do is actually pretty stupid, and then we say, no, you guys are stupid for not listening. And it's a good experience, and it's a good example of the real world. Although it's not very fruitful to have those kinds of discussions in a learning environment. So that is one of the things we are working on improving in Denmark. And it actually leads me to the question I wanted to ask you guys, which is why you as stakeholders in big important organizations do not pressure governments or vet schools into collaborating more with the medical schools or the pharmaceutical schools or environmental sciences, because we really need that collaboration. And as much as we veterinarians like to sit around and say we're very good at what we do and we know what One Health is, One Health doesn't matter jack something unless we get other people aboard. So what's the reason that we don't see more statements from you guys or more policies from EAEVE regarding the need for an actual course that collaborates with these other professions?
Yeah, so to reply to this specific question, I agree in theory with you. It's something which needs to be taken into account. The problem is, what are the priorities for day one competencies? And as discussed with some of you, the main problem today for you is the fact that the study program is already overbooked. You don't have time to think, you don't have time to talk, you don't have time to acquire what I call the difference between skill and competence. And for people who do not know it, skill is to do a cesarean section in a heifer without any problem. You look to the book, you do it, no problem, you are the king. Competence is to be able to do it in a cow with huge peritonitis because of previous cesarean section. Then you need to adapt. And this needs to be taught also to students by practical and clinical work. So the key point is what is absolutely requested to be taught for undergraduate students, what should be optional for students, and there should be a course on it. I fully agree with you. And what should be included in postgraduate education or in continuing education. But honestly, for me, my main fight today is to try to push the veterinary schools to reduce the amount of theoretical teaching and the amount of matter taught to undergraduate students. It is a matter of welfare of students, as said there, and I believe when I compare to what we receive and what is taught today, it's a huge difference. And the reason is simple. We always add new interesting things, but we never withdraw things. And so the total amount of matter to be taught and to be known and to be assessed is going up and up and up. And then students are not trying to really try and to know something, and then 2 days after the assessment you forget everything. Because we have another assessment, and so this is something we need to take into account, and it's a quite important challenge for our association.
Yeah, well, I'm sorry to hear what you said, but I absolutely understand and I agree with you. I just wanted to mention something, and I understand this difficulty that we have to talk to colleagues from other professions, and I understand what you say, and I think the problem is not just on our vet schools, but is how we have this open door to go into other professions and try to interact. Just to give you an example, I was a professor at Aracatuba at São Paulo State University, and in 1997 we found the first visceral leishmaniasis case in dogs in the state. It was the first case. We did a biopsy and we found out leishmanias, mastigotes of leishmanias there. And then the first thing we did was we went to this human health system to tell them, okay, if we have dogs with visceral leishmaniasis here, probably we will have humans soon, or we have already. So we need to interact and talk about this and see what we can do. And they looked at us. I was there in this meeting, and they looked at us and they say, "I'm sorry, but we cannot consider a biopsy that was made by a vet." That was their response. So we took this sample, we sent to a medical university, we asked them to do a report. They wrote a report saying that this was visceral, that this was leishmania, And we went back to these guys with this report from a medical school, and they accepted. So just to have an idea how difficult it is, because they just don't recognize us as researchers, or that we have the skills or we have the competence to do this kind of thing. So I think it's really hard, depending on where you are working, to achieve this kind of interaction.
Then I thank you for your honest reply to my question. But that, as you mentioned, is reflect the life, reflect the reality. Doesn't matter if it's in a school or in the society. That's clever reply, because that is the reality. But again, it's communication. We need to keep communicating. Not all the because what you told me is what happened many times between human doctors and veterinarians, kind of competition. Who is the most important? Who is the best? But this is a matter of communication. And I don't know, probably the next generation of female veterinarians are going to be less competitive in this way. But anyway, I have been talking I have been working all my life with human doctors, because I work all the time in the rural area, and the human doctors and veterinarians and pharmacists and nurses work together, work very close, and sometimes together. And then I work also in a healthcare center in a rural area, and I knew very well the doctors. They think they are the best because they have the life of the person in their hands, and that, as human, I can understand that. But we need to keep in this dialogue, and in some dialogue with some human doctors. I remember in one of these seminars or these panels, he said, "Well, it's incredible. He's a general practitioner, human." He said, "Well, in the history, in the records of the patient, they don't record if they have a pet or not. And pets already, the humans, they consider 40% of the humans that have pet part of the family. This is part of the family. If you are a family practitioner, a human, you need at least to know that there is a pet in this household. If you are not doing that, you are a pet practitioner. You have a pet system. That means that there are things that are so clear that we need to discuss to let them know that they are part of the family, that they understand that it's part of the family, that they are the pets. And they have very clear health consequences that they need to be. And that was, I like very much the talk we had yesterday that was about the cats, and that was very interesting also. Then use this, we need to use these things to open a conversation, not to compete but to cooperate. That we are here because both we want to help the humans and the society, and then we want to help them, to the physicians.
So I would also like to talk about two examples that I experienced this year working for IVSA. One of them was the EU directive about banning essential antimicrobials for the use of humans. It was an example of how, on the policy makers level of the European Union, the advice of veterinarians was not considered whilst creating a directive about such an important matter like antimicrobials use. And a great example was an advocacy from all the veterinary policy-making bodies, such as FVE, such as EVE, and IVSA was also part of this advocacy efforts. And thanks to this, the directive was not approved, and then it was reviewed with the input from professionals. Second example I wanted to bring happened during the World Health Assembly. Of course, the WHO member states were discussing different matters there. There was a conference about One Health. Unfortunately, there were not many veterinarians in the room. We discussed One Health and antimicrobial resistance without input of veterinarians, and the presentation focused a lot about how veterinarians cause problems because animal production and all of that, but is blame game really One Health is mentioning veterinarians, considering them in this way, One Health approach. This is not what we're supposed to do, but this is also a good example. It's not like we were not invited to that meeting, it's that we did not come to that meeting. We need to put veterinarians in the center of advocacy, but not wait to be included, but include ourselves. So I call for all the stakeholders here, please include yourself, because our voice is very important.
Thank you so much. So I'm giving the floor to Matthias for a summary for the first part, One Health and One Welfare in Veterinary Education.
So we heard a little bit about our first topic now, and I'm going to summarize the most important points. We heard about the implementation of courses in the education, the importance of the accreditation of the different universities, so that we have the high standard of education in different universities all over the world. So the first day skills are also very important, the practical training to ensure the same quality again, and to develop new tools to improve animal health. The practical knowledge about the implementation of animal welfare laws is also vital, and the involvement into engagement for animal welfare and One Health in student organizations like ours is also really helpful for that. Then, starting with working with governmental institutions is also a chance to do so. Then, we should start working with the governmental institutions to change the curriculum of our universities to implement One Health and One Welfare, especially in countries that have the most problems with One Health, like Latin America or in Asia. The importance of veterinarians in these institutions of public health is also important to show our role and our knowledge. We should be conscious of our knowledge about public health of the veterinarian profession. So about the current animal welfare guidelines and legislation and how we as students can follow it best. We should visit congresses to stay updated on new developments, visit websites like the one from CDC to have access to relevant databases. We should build connections to human practitioners and share our knowledge. We should also collaborate more, especially with partnerships and also collaboration between different associations. And if there are new legislation, we should inform the relevant person about these changes. So how could we implement One Health in universities? We should develop the skills lab or more clinics to improve first day skills and to prepare the students for their later work. Then we also stated that the emotional and mental health of veterinarians is a big part of One Health and One Welfare, because health is not just physical health, but also mental health. And the great concern about 25% of practicing young vets that dropping out of work is really concerning, and the high rate of suicide between in young vets or vets in general should also be nothing new to us, and a well-known problem. So about environmental health, that needs to be more into concern from different associations, but I think they are all working on it already. And we should focus on the new developments and new studies that are brought up, and inform people like farmers that contribute information to farmers and people that are involved in these important topics. Then the questions about how to open different channels of collaboration. A good point would be in university, like in Denmark, even if it's not perfect at the moment, but it's a good way to at least try and combine these faculties. How can we strengthen the role of veterinarians in the medical society? We should not compete, but collaborate, even if it's hard to get respect for our profession. And we should, all in all, reduce the amount of theoretical knowledge that we have to learn and increase the practical training that really helps us as vet students to be better prepared for our later job. Thank you.
All right. Thank you, Matthias, for that summary. And if you're all okay with it, we're going to move on to the second part of the panel discussion, which is going to be on animal welfare and its impact on public health. So the first question we have is, how can we involve veterinarians more in the surveillance strategies for infectious diseases? And then kind of like connected to that, the question of how can current disease surveillance methods be updated to improve the welfare of the animals being surveyed? We want to start with Rafael.
I think that we need to follow the recommendation of the different authorities in OAI and the rest of the national one. They need to cooperate internationally. I hope that the new strategies of animal health that are together, OAI, quadripartite that is in this moment, this is the only way. And again, in any of our positions, we need to be aware that we can do something. We see that something is out of the normal and so on. And even these days with the pandemic, I think the companion animal practitioners have been very, very involved in trying to see what's happening with cats, with the animals in zoos and so on. That means that, and some associations have organized a little bit that. We need to go in this direction, to focus more on that and following the recommendation of the organization and asking them to do that. And again, talking in this dialogue with the human doctor, with the human health authorities, human and animals.
Yeah, well, I think that there is a problem that we have, and I'm always talking about Latin America, of course, because I live here, yeah? But if you go, for instance, if you look at the United States or Canada, you will find a lot of maps of infectious diseases that you can find, and some of those maps are provided by companies like IVSA, for instance, or other companies, or labs like that they use this information, that they receive samples, they have the information from where those animals came, and they can build maps. So if you are a practitioner, for instance, and you go to your region, you will know that in your region there was a case of like Ehrlichia, Babesia, or anything like this. So this kind of information is very important for us. And this, you have different resources in Europe and in the US that you can look at them. Things that in Latin America is very difficult to have, first of all, because we don't have a reference lab here, so you cannot, most of our infectious diseases diagnoses are made by clinicians, by like, we don't have sometimes a PCR, or we cannot be sure that this is a diagnosis. You have like a CBC, you have the clinical signs, and then you think that this is Ehrlichia, for instance. So sometimes we are not sure, most of the times, we are not sure about which kind of disease we are dealing, and since depending on the antibiotics that you use, it will work for many vector-borne diseases, you never know exactly which kind of disease you were dealing with. And I think this kind of information is really important. We are trying, I have tried for many years to see if we could do this in our country and in other Latin American countries, because I think this is really important for us, you know, have a map, have a system that you could know what is going on your country, on your state, on your city. So if you are dealing with a clinical case, you at least have an idea if this disease is already or have been already identified in your area. So I think this is really important and it's something that we should try to do, but it's not easy depending on the country.
Sure. I was going to mention something very similar using a SIVA example. So SIVA developed a map in Latin America also and in Europe where the vets can use to put the leishmania cases that they have diagnosed. So that those tools would probably be more and more useful, and it's very easy for us to access now with mobile. So I think that's very important to be used in the future. So if we feed them properly, then we will have very important information. So for the students, I think it's very important for them to understand what the impact, what are the most, the prevalence of the diseases of the area where they are working on, and to really inform properly where they find it. So we can feed those tools and have the proper information.
So from my side, it's again a matter of development of surveillance strategies. So to tackle infectious diseases, we need prevention, and there is no prevention without animal welfare. And veterinarians need to realize that, because if we are not the leaders in this field, in animal welfare field, in animal field, that it's scary to think who is. So again, it's important to involve the necessary stakeholders to the table while developing those surveillance strategies. And by necessary stakeholders, I don't only mean veterinarians, but also young vets, students. Because like all the solutions we develop today will affect us and our future. So again, very important to have us here in the table.
To just brief comment, first one, we always need to remember that the first damage to animal welfare is disease. So this is essential to take this into account. Secondly, the veterinary profession, it's a unique network for the diagnosis of infectious disease. We need to remember that and know, by using just your smartphone, by using appropriate digital tools, by having a link with the appropriate lab, you can very quickly make the diagnosis of an infectious disease. And you should know that there are no extremely good new tools. Just an example, tomorrow morning I will show you a picture of it. You see, this is the smartphone, and now there are the tools, which is connected here, very small, and this little tool is a sequencer. So you could in the future do a sequencing of the gene of the pathogens to see if there is a new strain. For instance, you know the problem with COVID, with Omicron, etc. It's the same with many viruses for animals. And therefore, you should extremely rapidly send the information to the right authorities to make the right decision. So this replies to your question. And for people who are interested of it, it's already an example in France with the network called RESP in the equine species, which has 10 years ago initiated this network, of course, without the current algorithms and the current digital tools. But it worked very well. So the role of veterinarian is really essential and can be efficient in order to reduce the damages to animal health and animal welfare.
All right. second question, what role can industry play in promoting animal welfare? And I will give the floor first to Janiana. Sorry for my bad pronunciation.
No problem. So I mentioned this morning that from SIVA perspective, we understand that the industry has a very important role on it. So for many different perspectives. The first one, of course, is about the animals that are in the care of the industry. So dealing directly with research, with tests that need to be done on products as vaccines. Those are all today, most of them are done today directly on animals. So there is a very important role there to guarantee that not only the minimum standards of the legislation of the country are there, but the highest as possible. So that's one point. Second, providing information for the customers where we are selling products that really promote welfare of the animals. And of course, in the case of SIVA, we also look for the biodiversity to try to impact it. So there are many ways that the industry can play there, and I think that the industry has an important place in this discussion, because the industry can put together the authorities, because it's very close and connected to the authorities, and the industry usually has a very good and intense interaction with authorities. So it's an opportunity also to bring those discussions, to put together experts on the areas, customers and authorities, to bring those discussions in as possible. So I think that the industry can play an important role there.
If we talk industry today, veterinary industry regarding the practitioners, regarding in any field, I start to saw in some countries some recommendations to deal in the practices, doing good practices regarding the environment, to try to use less energy, to make a good use of the things that you are not using. I saw some rules, that are doing that. Even in some countries, the good practice rules mention that. Not only mention that mention also how to treat properly to your staff. That means that make connection with the well-being of the veterinarians and the rest of the staff. That's something that I start to see in our, we can say, our industry. And also in the human health industry. Some hospitals, that is huge buildings with so many technical issues, with so many waste of water and other things, and consumables, they start to pay attention on that, because we can do something. Regarding environment, any human activities, even individually, have an impact on the environment. Then it's important that any of us, and this moment we are talking about officials, pay attention to that. That's probably we are talking about One Health, including environment, is something that came to my mind in this moment. But somebody is doing something in this direction.
Okay, so I'm open the floor again for any delegate have question. Okay.
Katarina Fielding, IVSA USA. I wrote down my question because I didn't want to forget anything. So, following the focus on the human-animal bond after the COVID-19 pandemic, in reference to both increase in pet ownership around the world and emerging zoonotic diseases, the concept of public health seems to be a battle in which the only true weapon is excellent communication to both the general public and professionals alike. How do you all believe the veterinary world, both professionals and students, is succeeding and lacking in proper communication? And are there any changes you feel need to be made in order for the public health discussion to be influenced appropriately by veterinarians and veterinary students?
Yeah.
Thank you. So following the focus on the animal-human bond after COVID-19 due to increased pet ownership and emerging zoonosis, public health seems to be a battle in which the only true weapon is excellent communication to both the general public and professionals alike. How do you believe that the veterinary world, professionals and students, are succeeding in this field? And do you believe there's any changes that need to be made in order for us to succeed even more?
My only, if I understood well your question the second time, I think it's communication. I think we need to communicate to the, if you are a practitioner, if any of us, you have any client or any pet owner or whatever, I think the veterinarians normally, in any, when he or she is practicing, have the opportunity to communicate with the owner of the animal or with the client, whatever, our knowledge and then I think this is something we need to do. And of course, if the individual is doing that, the organizations, we need to do that. That's, I don't know if that's more or less go reply your question. But I think we succeed. After the pandemic, I think the public see in general, there is still people that doesn't believe on COVID-19 exists. It's an invention of the microchip, these kind of things. I mean, the good people that, normal people that recognize the link between human health and animal health more than ever. I think this is, of course, been a disaster economically, but for the point of view of the One Health, it's an opportunity, but at least if we need to communicate what we are doing. I don't see any other solution. This is any shortcut to do. Not only, and try to mention our clients, because this is the people that is going to vote, is the people that pay taxes. We can do that as institutions for our governments and so on, but the public need to be convinced. I think we need to go in this direction. That makes some sense? Your question or not?
Yeah, what I was going to say is that we paid a high price and we had to learn, and we paid a high price because of the pandemic. But on the other side, it raised a concern that people were not thinking of. And I think we are talking about on health and wellness and welfare and everything after the pandemic more than ever. Yeah, it was difficult for us. We lost so many people, and we had so many problems with pets and other animals around the world. But this was a price that we had to pay attention. And I think the whole world is changing because of this. I wouldn't say that we have completely succeeded. No, I think other pandemics will come, we will have other problems, but we are like growing in this subject as time passes, and it's, as I said, it's a high price that we are paying, but I think it was necessary for us to start looking in this other direction, opening our minds and like stop looking just being selfish and looking just at us, and maybe have this other concept of One Health. So I think we are getting there. I wouldn't say that we have succeeded, but we are getting there. We are talking more about this, and we are having more interactions, and we are opening our minds about this. That's my opinion.
And continue doing what we are doing, our work, but communicate more.
So I would also like to add into this. I think it's a very important question that you raised, so thank you for that question. Health literacy and the way how we communicate now, everything that we talk about right here, right now, to the public, it's very important, especially like following the outbreak of COVID-19 pandemic. The question is, how do we do it? Because there's such a big amount of fake news, there's the epidemic. It's very easy to find all the fake news on the internet, and the question is, how can we communicate better all the matters, the important, the legit ones, to the public so they actually see it, so they understand it. And I'm not sure if there is a right solution. We just need to try many different ways, many different perspectives. And this is also where I think collaboration with students come into place, because like young people have great creative ideas, we are innovative, but we are also like the community leaders, because we know the best like how the society works, how the communication on social media and all over the place works. So maybe this is something that stakeholders could take an advice from us, and definitely keep discussing different approaches to communication.
Alright, I think Matthias has a question.
Actually, the question I wanted to ask was kind of this topic as well. Because as you mentioned, Luther Wieler from Germany as president of the Robert Koch Institute played a high role in Germany. But during the pandemic, it also concerned me that many people like discredit him a little bit because he's just a vet and not a real medical doctor. So I also wanted to ask how we as professionals, we know the concerns of animal welfare, One Health, human welfare, but how we communicate this better to the broad public. But yeah, this was raised. So yeah.
Talking about communication is not only the technique of communicate. I think it's the authority of the people that communicate. If you are a veterinarian, if you are a good veterinarian that treat your clients, your patients well, you are going to have a credit. What you said have some authority. If you are doing a good job, if you are ethical, if you are treating them, you are going to have an authority. And I agree with you that still the big public make this relation between. I totally agree with you. And you are in the country that you see more than I just read in the papers that regarding the president of Institute Koch.
Want to add something, Annie? Sorry, Daniel, Lauren, you have a question.
Loren from Switzerland. I think I will come to my question real quick, but I think the term of communication is also like more not about how to improve the communication, but more how to gain the trust of people, of the public, and I think this requires then more transparency to win the communication with the public, to gain this trust. Also, when we say the medical institution didn't accept the biopsy made by a vet, or as Daniel said, that it's just not so nice chat between vets and medical students. I think there it's just the improvement of the communication to gain them more trust. Also, when your vet advises you not to buy puppies online, and you think, why, it's cheap. That there, I think, a big improvement needs to be made, and this is also a challenge, and we should really work on a way to improve this.
Yeah, I totally agree. More or less, I try to say the same that you expressed, but there is a way to deal with that. There is ethic, I mentioned ethic, and there is statutory bodies that need to control the good practice, and try to separate the bad practice. And of course, with internet, it's very difficult. When there is something wrong done in internet, it's very difficult. But yes, the trust and the ethics and so on is something that we need to build together. Help, if possible, by the different authorities, including the veterinary statutory bodies, I mean chambers, orders, whatever, colleges, colegios. It's called in different places. That is very important also to regulate the profession.
Go ahead, Daniel.
So, I'm going to come up with another controversial opinion from the second row here. You mentioned that vets have an authority if they practice well and they do their job. I'm of the exact opposite opinion. I believe the authority, either as a veterinarian or as a medical practitioner, is going downhill. The general public does not respect the authority of any given education as much as they used to. Believing that they will respect that opinion is going to get very difficult, and it's going to create more problems than it solves. And instead, the general public has turned towards both the internet and also major collaborations between multiple different partners in order to create these truths, so to speak, where no matter if they're fake news or they're real news, these ground truths have changed from what one person thinks to what multiple people think. How do you guys propose to collect this authority from multiple different people so that we actually do have a say? Because even in a country like Denmark, where people are generally quite believing of the authorities, everyone's skeptical all the time. And there's a reason to be skeptical, because you can easily find out that one little detail out of a 1,000-page document is wrong. But we still need to think about how to better that for the future.
Oh my goodness. I agree with you, and I think the internet has a bad impact when you think about this, because at least as a practitioner, apart from being the vice dean of a university, I was a professor in small animal internal medicine and infectious diseases. And I used to have classes with my students 3 times a week in a hospital, and of course 80% of the cases that arrived to me, they came already with a diagnosis, because of course Dr. Google is more important and is more clever than us. So when you start to talk with these people, it's really difficult to change their mind. I absolutely agree with you. But there's also a thing that Rafael talked about is when you use science to talk to these people, when you try to show them. I used to spend like 1 hour and 20 minutes on a consultation, trying really to explain all the mechanisms and everything that was going on. And you know, you start to have a connection with this owner, for instance, and they start to trust you and they start to believe you more than other information. But the problem is that we have social media, and we are not going to get rid of this, and this is going to happen all the time. Of course, I'm not here to talk bad things about Brazil, but I have to mention some stuff. And I am really ashamed to say this when someone asks me, especially when I am in an international meeting. You know how many vet schools do we have in Brazil now? Do you have an idea? We have 1/3 of the vet schools of the whole world. We have more than 460 vet schools in our country now. And then I ask myself, how many professors, how many people we have teaching those guys, you know? And we don't have accreditation in Brazil. If once you have your diploma, you are free to like practice during your whole life. You don't need to do anything after this. So I'm just mentioning one stuff that is, in my point of view, is really important. How are we releasing those guys in the market? You know, how can I trust? And I am not talking about a private or a public university. I'm just talking about, in general, how can we trust if we are releasing more than 100,000 vets per year in our country? This is ridiculous. And this is just an example. So I think though this kind of situation is contributing to this, what you meant. I know that you were talking about Denmark, but I'm talking about our situation in Brazil. You hear so many things coming from a vet that seriously I want to die when I hear those things. And then when you that have some experience or some knowledge, you try to talk to these people, it's ridiculous because the owner believes in the other one, not in you. So this is really a problem. I think this, I don't see we getting rid of this kind of situation easily, but I think that talking in this interaction, like practitioner or owner, or this direct interaction is the only thing that we can do to try to diminish this kind of situation.
I totally agree with you. It's a reality in our society again. But not only they don't have authority, in some cases, some people use social media to go against a veterinarian or a practice. It's a real problem. That there are ways to deal with that also, but this is a real problem with practitioners. Not only that they don't have, because they are using Google too, but I want to, and it's something regarding more psychological, philosophical, sociological of our society, that is not only about our profession that suffer that, we suffer in general. But still I want to believe that the personal relationship still is important. The virtual is there, it's a reality, but it still is important. And yes, in the short term, you can not be confident. But in the long term, you can see what is a good practitioner and what is a fake or a. I don't know if in the future it's going to be a digital tool that can perform the same as a human doctor, as a veterinarian. In this moment, I doubt. But we are in this discussion. You are right.
How can we have a personal relationship?
Okay, that's okay. Okay, I don't have a. Okay, yeah. Difficult question. I cannot reply.
Just to continue with a controversial approach, I believe that the direct and unique link between the client and the vet is dead. Why? As you all know, artificial intelligence is stupid. However, it cures itself permanently, and it improves. Just the example of translation between Danish and English with Google. 10 years ago it was a joke. Today, most of the time, if your Danish language is correct, the translation will be correct. So it's huge improvement. So I believe in order to fight against social network, against artificial intelligence, we need to use them appropriately. So, as I always told when I speak about artificial intelligence, never the robots will replace the veterinarians. However, the veterinarian who can use these tools appropriately will replace the other one. And I believe this is something that we need to take into account. The future is not a dual interaction, it's a triangular interaction between the client, the vet, and the digital tools. And they need to work together.
So I also wanted to add into that, I think highlight a different part of your question. It got me interested in how you highlighted the shift from respecting one person's opinion to multiple people's opinions that are now more prevalent. And I think this may be a solution to the problem that Mary raised. Now we don't necessarily need to maybe put that much of an emphasis on like trusting one single vet, one single practitioner, one single person, but rather encourage a collaboration between different veterinarians, groups of veterinarians, different stakeholders, and ensure that those collaborations can be trusted, that those collaborations are good, and that those collaborations are transparent. So increase our trust in those collaborative efforts of veterinarians, different stakeholders, and different professionals working together is crucial.
All right, thank you. Do we have another question from the floor? Lisa?
I think raises a very important point about not trying to fight against the flow of social media and digital developments. As in, this is probably such a historical, groundbreaking development. You can't go against the client, you have to go with it. And I think that is something I see a lot still in practice, is on the one hand an unwillingness to go with that and say, well, social media, I don't know how it works, so I'm not even going to try. And on the other hand, not knowing how to communicate appropriately. And we see a lot of issues in my country, from the Netherlands with this, that social media practices, they've started to dabble in having a Facebook page or an Instagram page, and customers do use that to leave bad reviews. And how does your client find your clinic? They Google it. So if they leave enough bad comments, your clinic might as well be shut down at some point. So I think that is something that we should also keep in mind too. I was wondering what your opinion on that is.
Does someone want to answer the question, or is everyone like, no? That's also.
Because the mask and that's all.
Do you want to repeat it again? With the mask off?
Yeah, it's the last question. So, how do you think veterinary professionals should deal with social media in an appropriate way?
Question being, how should veterinarians deal with social media appropriately?
In social media, as in veterinary profession, there are professionals that know how to have a study. They know, and there is already in some countries veterinarians that are advising practices how to properly use social media. In this case, I should, if I was a practitioner, I would go to such a professional in order to teach me how to use properly, to defend or to publish the communication. That's my opinion. I talk with some of them. They are professionals that know the social media. They are offering the services for the veterinarians. Because sometimes, and in the other side, I have been in a local association that the veterinarians came to the association telling there is this problem, I have this problem with this client, asking for help. And there have been some associations that have complained legally with this client. Some have win, but others no. It's very difficult to demonstrate because there is the right to write, there is the right to expression of anyone, and there is then my solution would be, if I was in this case, I will go to a professional in order to help me how to deal with this. Help me professional social tools. More we need to rely on professionals. Or to Google to try what is the best. I will go to a professional.
Yeah, I don't know if there's something what you meant, but one thing that sometimes drives me crazy is when you go to Facebook and people start to talk some stupid things and you see those discussion, and usually I think like I count until 100, and then what I do is I post a link to a proper information, you know, like I try to do this. I'm starting to prepare myself emotionally not to go into the discussion and say a lot of things that I wanted to say, and so I keep this to myself. But I usually try to post a link related to this discussion with some really scientific information about this. So if people want to see and want to go to this link and try to find out which is the real information, they do this. And but I think this is a problem that we will face for now, forever, you know, like we are not going to get rid of this kind of situation.
So from a student's perspective, as I already mentioned, there is a big room for collaboration between stakeholders and students, since the students are the one who has a great understanding in the, these current communication ways of the society. I believe we definitely should not fight social media. We should just find a way to be apparent there and communicate our message, all the scientific things, in an easy and approachable way to a general public. But I would like to actually ask a question to Janaina, because I believe it's a really good question for the industry part, because industry is the one that really understands demands of the society. And maybe there is also room for collaboration between the stakeholders and policymakers and industry in this field especially.
I agree with you that the industry has an important space to work with this kind of information through the social media and through all the electronic systems. And I also think that in the same way that there are people, first people look for easy information in the social media. So that's here an opportunity also for the industry and for the vets and for the association to give proper information in an easy way so that the people can find it, get some good information and go to the links where they can have more details when it's interesting. And I think that in the same way there are people looking for some wrong information or to associate with people to fight about everything. There are also good people looking for good information. So I think looking for the positive way, we should try to communicate with these people that are looking for good information and can find in the association links, in the industry links, where they can really trust on it. And I think that the industries are using more and more. That's all very new after the pandemic. They started doing a lot of online events that are easy to access, are free. So here is also a lot of opportunity to get good information also on those kind of places.
Just to comment on your question, you are still with us. I believe the key point for a veterinarian is how to better use your time. When you use your time to speak with clients or to chat on a social network, you don't do it from treating animals on advising or right things. So I believe that today, because of the available tools, we can save a lot of time. Many times of veterinarians in the past were there to repeat and repeat and repeat always the same thing. We call it frequently asked question. And you have that on all websites, and most of the time there is the right question and the right reply. And today there are more and more use in human medicine of chatbots. As you know, they are more and more up to date. I don't know if you are familiar with the Turing test, but the Turing test is more and more wrong, because people believe it's the right person who replies, and in fact it's artificial intelligence. So again, I believe we need to work together with these tools, but we need to keep in mind that veterinarian is really an elite profession, and we need to keep our time for important things, for health and welfare of animals, human and environment.
All right, thank you. Do we have another question from the floor? Let's hear something controversial.
This one is actually not too controversial, more of an idea for the future. Considering what Pierre said regarding the curriculum being more and more condensed due to the continuous amassment of knowledge in the veterinary field, at some point we will reach an impasse where we cannot fit any more into the curriculum, but we also don't want to get rid of anything. And when we reach that point, which I argue we have already reached, we need to figure out how to educate veterinarians going forward. Because at the moment, most places in the world educate veterinarians as a generalized vet. You don't specialize in companion animals, you don't specialize in large animals, you don't specialize in biomedicine, One Health, and all of these other things. Are any of your major organizations doing work or looking into how you could split this education up, or how you could persuade governments to change their legislation so that you're actually allowed to make the university education, the vet school education, more specialized and more future-proof with regards to both being authority, an authority figure, and having all the specialized knowledge, having the digital skill set, and still having the knowledge required, the competence, the competencies required to perform your given tasks on day 1 and day 100, but also in multiple years after you've graduated. If that makes sense to you.
So, extremely good question, extremely important item for discussion, and extremely difficult things. Why do we recommend it to graduate general practitioners in 5 or 6 years? There are many, many reasons. Some of them are linked to legislation, and some are linked to the student or the vet itself. From many surveys, it was extremely clear that many students started studies with something in mind and decide, most probably in final year, to change their orientation. Secondly, even postgraduate veterinarians realize that, for instance, they hate food safety and quality as students, but then they discover that it can be a very exciting part of the profession, and sometimes it's much more compliant with family life. And so that's why so far it has been decided to keep a general degree and to leave specialization for postgraduate. In the past there was some what we call pre-tracking system. It was initiated in Utrecht some years ago, and I believe Utrecht came a little bit back because it's but it's in any way we need to continue to discuss on it. It's a key problem, and in any way we need to reduce what is the main cause, like in human medicine, and to put it for, let's say, 1 year tracking system for veterinary. Just for your information, you know that in many schools, the final year is the tracking. It's a year of stage, mainly done, partly done intramurally, partly extramurally, and the student is allowed to select only companion animal, equine, food-producing animal, food safety, research, etc. So there is already some tracking, but the basis must be strong for all undergraduate veterinary.
Yeah, I think this is really important, and this makes the difference in our profession. The fact that we have this general formation, like we can think about everything. We have this open mind about all those subjects that we learn in our profession. I am really afraid if I don't think it's a good idea to do this, like to specialize since the beginning. I am an example. I started my graduation and I was sure that I was going to work with horses. And I ended up being a professor of small animal internal medicine, you know, like. And this, since the first day, the only thing that I said to everyone was, I will never work with dogs and cats. And see what I ended up being a professor of this. So I think this is, we need to keep this, you know, like this is really important.
I used to put this question when I am with a dean. I put just today with the vice dean of this school, the same question as you. And I did when I was in Copenhagen, I put also to the director of the school. And so far in our association, and in another association, is not on the agenda, on the formal agenda to discuss that. Is theory. We discuss as today, we are. And then for me, my reflection about that, first, I think human doctors, they don't finish in 5 or 6 years. They need 2 years more residence to start to work. Second reflection is, if we are going to start divided in different species, we have many species to divide. Could be less. And first of all, we are going to lose the perspective of One Health. We have the perspective of One Health because we are dealing with many species. We know how the diseases come to one species to other. That means we lost this idea that are talking here. The other one is that we are going to be divided the profession, and that we are going to talk with the policymaker of the authorities. We are going to divide it in I don't know what they say in Latin, divided and impera. No? Then this is my reference. But it's a good question that I make myself. But I think so far it will stay as it is. And then that makes sense also with what you mentioned before. You start to say, and I hear many times with the different deans in the schools, the pressure they have to teach it that much more and more and more. It's impossible to teach anything. And that's make relationship with what you said, Anna, you mentioned that infodemic. The important is to have the principles. The information is, we need to know how to go to information. I think the more important thing we can have for a nice school, for a university, is the criteria, the ethics, the way that Google or artificial intelligence is not doing. That is the human relation, is the soul, the spirit of the human being. I don't know if I am all romantic, but I thought that the humanity go in this direction. It's my but yes, it's a lot of information, infodemic, and we need to deal with that. But as the authority that I should like to have is the authority of the science, the authority of the ethics. Many people, you are studying based on science, but many people don't believe in science directly. And you know what science works, but people outside, they don't understand what science is and don't believe in science. How to deal with that if we are scientifics? How to convince somebody that deny the science?
Just one thing that came to my mind now is that I think we have to teach professors that their subject, the subject that they are teaching is not the most important one in the whole world. And this is something that happens all the time. And it happened to me when I started to teach, you know. I remember I graduated in this school. I had nephrology with a teacher, a professor that is retired now. When I gave my first lecture on the same subject, I had my notes still from when I was an undergraduate student, and I looked at her topics and I said, gosh, this is ridiculous. She didn't teach me what she had to teach me. I have a lot of other things to teach my students. And I gave my first class and I was like, oh gosh, I did better than her. And it took me 2 or 3 years to understand that she was right. She was giving us just some topics that we needed at this time. I didn't need to give all the information that I have to my students, and it took me like years to understand this. This is maturity, you know, like, and people don't have this maturity. Sometimes you stay like 40 years teaching, and you still think that you need to teach everything you know for your students, and that what you are teaching is the most important thing in the whole universe. And I think this is a human problem, and we have to deal with this.
So even though we are still teaching students in the general things, I believe there is an increasing rule of specialization in the veterinary profession. We cannot deny that, but this is why we not only need to raise awareness at the university level among teachers, professors, but also among practitioners, because students graduate, we specialize maybe in something if our university gives us an opportunity to specialize in one direction that we like the most, and then we go into practice, and the practitioners, because they were taught a different way than the young people are taught right now, maybe they were less specialized, maybe they had more focus on the general knowledge, they expect the students to know everything about everything, and this also has a huge impact on the mental health of these new graduates, and maybe it's also one of the reasons why the new graduates leave the profession, because they cannot focus on their interests. So this is also another topic that's very important to raise, not only at the academia level, but in general.
All right, thank you. Did anyone else want to add something to that? All good? All right, looking at the time, I think we have about 10 more minutes, so I suggest we go into the summary. We're ready. You have it all? The microphone or not? Or do you want to scream?
So, about our second topic, about animal welfare and its impact on public health. We heard about the involvement of vets into surveillance strategies for infectious diseases. We heard that the dialogue with health authorities should work better, that there are already lots of existing maps about infectious diseases that helps the public and also veterinarians to see the risk of being infected with such diseases. They already exist in the US and the EU. It's still a little bit more difficult in Latin American countries, but things getting developed or will work in the future already exist. Vets and vet students should take a big role in One Health and animal welfare discussions to bring their experience and their training into these discussions. And new technologies for fast and easier detection of diseases also will help in the future. Then, possibilities for the industries to promote animal welfare. We have to improve the situation of animals used in the industry above minimal standards. So not just keep the standards that are in the legislation, but also improve them even more. Then provide information to customers what your company is doing and how your company helps with improving the animal welfare situation if you do so. Then use the close connections between the industry and the lawmaking authorities to improve standards and help animal welfare. Then about communication between veterinarians and the general public. The pandemic raised the awareness on topics like One Health and One Welfare. We should communicate the work we are doing and improve our communication with the general public to provide them with scientifically based information and stop the spreading of fake news and wrong information. We need to involve good practice and show the people how good practice is done and what the people get out of it. and to work in an ethical and proper way to convince people to trust us, to gain trust through open communication with the public. Then concerns that people respect the authorities like vets' rights through misinformation in internet or other sources. We have to convince the people, as I said, through a thorough examination and through discussion with patient owners. We need to use artificial intelligence or social media to convince the people and to improve the situation. And we also need to use social media to inform the people about different topics, and that helps us having to tell the people less when they're at the clinical practice. And the trust in the community of veterinarians is important and should be strengthened. So how should veterinary professionals deal with social media? They should hire a professional that knows how to do it, to do it in a proper way, and to let people see that it's actually done the right way, and that these professionals respond in a professional and right way. They have to provide scientifically proved information over social media, as I said, to inform the people even before coming to the practice. And they use it as a source of information. Then we have the topic about a specialized studying, I would call it. The one point is that the legislation keeps the universities to change the studies into a more specialized one. And the other topic is, as a student or vet, for the student or vet himself, could change his orientation during the studying or even during working. And if you just offer a specialized studying, you would keep the people from changing their possibilities of work. So you have to do it with an open studying to provide them with an open working field. There are already some tracking during studies, like choosing where to do your externships or where to specialize, in your studying, like doing picking different courses. You have to have an open mind through learning all different fields. So if you just specialize, you might lose track of the whole different topics the veterinary job provides. You also lose the perspective of One Health if you just specialize in small animal medicine. You might not be aware of what the entire microbial use in farm animals has as consequences. You have to teach professors that the subject is not the most important subject, but to provide the students rather with a basic knowledge, and if that's their field of interest, they will go in that field and inform about that field themselves. And they have to keep in mind the difference between newly graduated vets and long-time practitioners, because the way they teach us in universities right now is definitely a different way than it was 50 years ago. So this is also a problem we have to keep in mind.
All right, then I think we've come to the end of our panel discussion. I want to thank all of you for being so interactive and for asking questions, and a big applause for our 5 amazing panelists. All right, thank you everyone for being here. Lisa had an announcement to make.
Stepdaddy again. First of all, there are currently 4 people who have yet to pay and pick up their iTunes.
which I would like to make the walk of shame after this to the DA corner, where I will wait for you and you can pay and get your item. Last chance. That will be Julia de Mater, Nelson Achon, Eva Sarkova, and Anya Chiklich. And then Bailey and Rachel, there are still two items in my room that you've already paid for and that you get to pick up, so step by as well. Then in total, with all the auctions, we have raised €3,435.75. Thank you for all your items and all your contributions. Meryl, will I give it back to you? I will just go.
About this. I totally forget about this. Say hi everyone before I accident it. Goodbye. Bye. Done.